Okay. Thank you, everyone, for coming today to our talk. I think it'll be a really interesting talk. We have some great speakers lined up, including myself. Feels weird to say that, but I am one of the speakers. So I think we have some good talks today that are really interesting, and we'll have some time for questions after each speaker. And then we can also, if there are any other questions at the end, we should have a few minutes left for that. So to get us started today is Maggie, and she is a third-year psych PhD student in the Institute for Mental Health, and she is working on self-harm and suicidality in South Asian women, and she has a green thumb, which she's been honing during lockdown. So Maggie, take it away.
Just doing the awkward presenting bit. I hope that's fine. Thanks for the lovely introduction, Sarah. Yeah, so I'm Maggie, and I'll just give my insights in trying to do international research during the COVID pandemic and tell you a little bit about how I've sort of adapted to it and just some kind of tips that I have. So just to start off with a little bit about myself, I'm a Global Challenges PhD scholarship holder, like my colleagues here on the call. And originally my research was looking at self-harm and suicidality in Pakistani women in Birmingham and Karachi. So it was looking at kind of comparison between the two countries. And due to the sensitive nature of the research, I was very much looking at doing kind of community-based interview studies, and that would really involve me being in community settings, in women's centres, building trust, just being in those spaces until people felt really comfortable with my presence to start having those conversations. And I started doing the work that I wanted to do in Birmingham just before the pandemic started, and then I was meant to go to Karachi, but obviously because of COVID, international travel was stopped, and Pakistan is a country that's kind of between the sort of red and amber listing of the FCO, so it's really going to be very difficult to travel to, but it also wasn't appropriate to necessarily train somebody else to do my research, so I've had to kind of completely adapt, and I'll tell you a little bit more about that. Besides my PhD, I also do some other work in other sensitive areas across the globe, so some various countries, but it's all quite confidential, but in bits in Asia and Africa as well. And for me personally, the reason I do this work is I've grown up in various countries across Europe, Asia and Africa, and I've always been interested in working internationally and actually just really appreciating and seeing the need for more work to be done in other countries, but really kind of working locally with collaborators and having that sort of sustainable partnership is something that's really important to me. Just some general tips. I think when I started the PhD, I was really excited by the prospect of working in the UK and working in Pakistan, but then I realized actually on an institutional level, there's very little support for international research, and you have a lot more paperwork to do and a lot more confusing aspects that you kind of just learn through trial and error. And then the pandemic is another completely different dimension to being able to do this work. So just some, I don't know if there's some people on this call who are already in the midst of doing this type of research or just starting, but would really love to hear insights at the end of the discussion. But just from my side, just a few tips. The kind of FCO travel advice is the go-to place. That's very much what the university bases its decision on, whether you can go or not go. And that's also very much linked to whether it's the University of Birmingham that you're at or another university or another kind of institute. The kind of needs for various ethics and risk assessments will be quite different for what you need when you're doing international research. And you might need to adapt them based on COVID and kind of other areas. And it sneaks up on you, the amount of paperwork that you have to do, but also actually often you have to pay for, obviously for the ethics in the different countries. So thinking about that and putting some budget aside for that, but maybe also you might need to set up a bank account. If you're doing this type of work in the local country, that could be really helpful. Time differences are always a fun one to navigate and very confusing, especially if you have different people joining from different countries. So thinking about what are the best times to run things, and apps like World Clock are really helpful for just, if you're not as great at, especially with summertime, I think it's very confusing to keep track of. I found WhatsApp really useful for international meetings where you don't actually use a video and you're not that dependent on whether there's power outages or strong internet. So actually just thinking about what are the sort of helpful bits, and translations, depending on which countries you're working, but often absolutely fundamental unless you speak the language. But even then, if you speak kind of conversationally or academically, are two very different things. I think that's always something to account for in your budget and when you're thinking about traveling, and things like the Engage guideline, which is something that's been developed through the University of Birmingham through IGI. It's looking at how can you really foster those sort of sustainable equal partnerships with local collaborators, and actually setting out, making sure that people are rewarded for their work and understanding what that partnership involves. And I think that's really important when you're actually working in other countries, of who are you working with, how can you support each other, and what is everyone getting out of this, and how's everyone being supported. So that's quite a nice, it's about gender-based violence, but I think it really applies to other sensitive work as well internationally. Thinking about adapting your research. So for me, I was obviously looking at this comparison between Birmingham and Karachi, but thinking, well, what can I do? What is the essence of what do I want to know more about? What is important to me? And how can I keep doing this work? So it could be thinking about if you have any kind of secondary data or doing it online. So for me, I'd done some of the Birmingham studies in person, but then some online. And that felt safer and more comfortable for some people. But then there was a stage when I was looking at interviewing young people, so teenagers, about their self-harm and suicidality. It didn't feel safe or comfortable anymore to do any of those interviews online. So I think it's constantly about reflecting and adapting and realizing what is appropriate for your participants and for your research. And I think it's really painful, and I think there's a kind of mourning process that comes with scrapping parts of your research, but that's also okay, and that's the best for this decision for the time, and it's okay if you have to do that. And I think Sarah will also touch a bit on this in her presentation, and it's okay to also feel a little bit upset about it and that your PhD or your research has gone into a different direction. But trying to think about what are the benefits of doing it differently. And for me, some participants felt it was easier because actually online you could do it anytime. We didn't have to fit it within their schedule, and it felt more anonymous. So there can be some benefits to thinking about adapting it. And yeah, if you're still doing it internationally, keep talking to your collaborators or your other members of the research team or the PI or supervisors about what they think the situation is. And I think, yeah, don't get too fixated on a plan, because the plans can change. And I think particularly with international work, it changes even more quickly and dynamically than in other situations. And the final bit I wanted to talk about is looking at working from home on particularly sensitive research of, in part, how can you make sure it's safe to continue doing this research to protect your participants? So that's things about, actually quite practical things about, how are you saving sensitive data if you're not able to go to the office? How can you make sure that this data is kept in a safe space? How are you including this in your risk assessments and also your kind of online risk assessments? But also, what kind of support mechanisms are there in place for your participants after they've participated in your study? Is there anybody that they can go and speak to, and actually realizing, is it safe for them to participate in your study online when they're still in their home? What is that home environment looking like, and how much support can you offer in those situations? If they say something, it does feel sometimes easier when you're in person with somebody and you can talk them through and signpost them to places. But online it might be more difficult and you don't know who else is there in the room. And I think the other thing we don't talk enough about as researchers is, what about your own mental health? This last year and a half has been really, really difficult in so many ways. And even if it's in the own way of just being really mundane and not being able to leave the space, and I'm working in my living room, and you're always in the kind of same spaces, can you navigate those spaces and say, okay, when I'm on this side of the room, I'm at work, and when I'm on that side of the room, I can switch off, and I switch off guilt-free, and I have some kind of debriefing mechanism. But also thinking about, I live with my partner, how can this still be a safe and enjoyable space for him as well, that it's not just about my research and my work, but actually that it's our home too. So I think these are conversations that we need to keep having, and I don't think we've figured them all out yet, but hopefully we can sort of discuss them some more. So try to do that in the 8 minutes. And the questions I wanted to pose, but really open to any questions, is thinking about how can we keep pushing international research when we're having these issues with international travel, and also actually recently looking at funding stopping for international travel, and actually countries and populations that maybe are the most vulnerable and don't have the kind of resources. How do we continue doing this? Thank you.
Thank you so much, Maggie. That was really great. Does anyone have any other questions for Maggie, or does anyone want to discuss the question that she has posed to us? Feel free to unmute yourself or just write it in the chat and we'll address it there. Any takers?
Yeah, thank you, Maggie. Thank you for a very sort of interesting presentation. I'm gonna put the question back to you. What is the answer to this question? How can we keep pushing international research? So based on your experiences, you know, throughout your PhD, what would be your recommendation for this? Or is that mean to put it back to you?
No, I'll take it. I'll start the conversation. We can see if anybody wants to chip in. I think we need to keep it on the agenda in some ways, that we don't forget about it. And I think for me, with suicide research, you look at it and you go, the global burden of suicide deaths occurs in low and middle income countries, yet a fraction of the research is done in those settings. And we actually know so little about it. We don't have the conversations with people. So I think we need to keep pushing it, but it shouldn't be in a sense that I'm coming from a European country as a European saying this is how it's done. So it's actually, in a way, how can we continue these conversations and dialogues with people in the country so that they say these are the issues that we need to prioritize. So I think it's kind of having that, and it is really difficult not to be imposing yourself. So I think in one way we have the power to push this to the kind of funding the governments and saying we need to keep doing work on this. This is important. And I think with international travel, in some ways it's good because we're obviously reducing our carbon footprint if we're not jetting around the world. So thinking about what kind of interesting ways can we keep doing research with technology and adapting it in a kind of safe way and getting maybe almost a bit more creative. I think sometimes in academia we get a little bit, even though some of our ideas are obviously pushing the boundaries, but sometimes in the methodologies we stop getting as creative as we could be. And is this maybe an exciting opportunity to think about it in a creative way? I think that's helped. If anybody else wants to chip in, please do.
Does anyone else have anything they'd like to add to that? No. All right, great. Thank you so much, Maggie. That was great. Next, we're going to move on to Catherine. And Catherine is also a third-year PhD student, and she is in the Institute for Applied Health Research. And she is looking at health interventions for household air pollution in Rwanda. And she is also a singer with the City of Birmingham Symphony Orchestra. So take us away, Catherine.
Thank you, Sarah. So I'm Catherine, and as Sarah said, I'm from the Institute of Applied Health Research. And I'm going to discuss a bit about the challenges of undertaking remote research in low middle income countries, sort of comparing the difference between in-person and remote data collection and what challenges but also opportunities these present. So firstly, a bit about my research. So I'm investigating household air pollution, which is produced from cooking on biomass predominantly, wood, dung and charcoal, producing really high levels of carbon monoxide and particulate matter as well as other pollutants. So we've got this problem, but how do we go about combating the health effects from household air pollution? So there's different interventions. There's long-term interventions, which are cleaner fuel transition, which ultimately wants to be the end game, such as LPG and electricity. However, they face multiple barriers and are often not culturally appropriate in some settings. Therefore, there are alternative short-term solutions such as behaviour change and structural changes like installing chimneys or improved cook stoves, which could present a health benefit in the short to medium term. So pre-COVID, my grand plan was to go and monitor the air quality in homes in a deprived area of Kigali, the capital of Rwanda. Comparing the difference between indoor and outdoor cooking. Outdoor cooking, about 30% of the population already cook on outdoors, but hasn't been well characterised as the difference between the difference in the air quality. Therefore, I was looking to harness this existing behaviour and see if we get more people cooking outdoors and what could facilitate them to cook outdoors. So with the air quality monitoring, I was also planning to do a detailed household survey to add more context to the air pollution measurements I was getting. In addition to a willingness to pay questions, which comes on the back of a charcoal ban, which is being introduced in Rwanda, to see what people would do if they could not get hold of charcoal or was too expensive for people to pay for. And finally, a focus group and photo voice exercise looking at the opinions and barriers of cooking outdoors. So I'd been out to Rwanda in October 2019 and trained up some field workers to take the air quality monitoring and sort out some of the paperwork and ethics and everything else. So pre-departure, I had many challenges in looking at the risk assessments and trying to get some of the in-country approvals done before I went. However, the way that works is basically you have to go and knock on people's doors and talk to them to get some of these approvals through. When I was out there, there was issues with language barriers and timekeeping. I would often try and organise a time and it would actually occur 2 hours later. In addition to gaining an accurate sample size in the cell that I'd selected, the people or the locals who were helping me identify the sample were choosing the people to go into my sample rather than giving me all the people who met the eligibility criteria for the area so that I could take a random sample. So there's difficulty in gaining an accurate sample, even when you're doing in-person research. However, COVID prevented me from continuing doing the air quality monitoring. So I had to stop the air quality monitoring for the safety of the participants and also the field workers going into their houses. But in addition, we had lockdown. So I switched to a more extensive secondary data analysis of the demographic and health survey to try and answer some more health questions on air pollution. I switched the willingness to pay questions to telephone, and instead of doing focus groups, I did telephone, or I'm going to do telephone interviews and focus groups. So there were further challenges in trying to switch into remote research, maintaining strong collaborations and momentum. Obviously, Rwanda went into lockdown and it was a very different situation there than it was here. So trying to keep up that momentum and trying to move forward the development and planning of remote research methods was difficult. In addition, the lockdowns prevented me from retraining the field workers into different methods because many of them don't have internet or Wi-Fi in their own homes, and I was reliant on the university reopening in order to get them into the university to do training. I had the same problem again with gaining an accurate sample, and in this case it was trying to get the mobile phone numbers of the participants of the study area, so I've taken an opportunistic sample rather than a convenience sample. And in addition, in-country approvals were also difficult because I had to extend the research permit due to the delays, and that was impacted again by lockdown and the difficulties in them in Rwanda undertaking home working and things like, because they weren't always in the office, which made it difficult. So the challenges and opportunity of research. So as I mentioned, the challenges as in communication and organisation, but also in training remotely rather than in person is difficult as well, to really check and see if your field workers have understood what you've been trying to teach them. In person, you could do more role play, and you could observe their non-verbal communication, which made it easier to understand whether or not they had understood what you were going on about. And in addition, trying to maintain research validity if you're not there to either help collect the data and maintain and keep checking that the data is being collected accurately and appropriately. However, there are plenty of opportunities. As Maggie's already mentioned, we've got less air travel, therefore lower good for air pollution, but also lower costs. It also gives us the opportunity to develop and use transferable skills and to develop problem solving and creativity. I sort of summarised it in that we've got all these skills and that doing remote research might be different and require a different set of skills, but we have them all in our toolbox. It just requires us to think about them and look at it in a different way, to think creatively with problem solving to combat the challenges presented by remote research. So in summary, it's be ready to respond and react and have all the tools in your toolbox is my main take-home message. Look, I've got a couple of questions for discussion. how do you maintain effective collaborations and momentum effectively when research is undertaken remotely? And how do you maintain research validity in remote research?
Thank you so much, Catherine. These are really interesting questions. I hope someone has some ideas or anything from their past experience they might be willing to share. Again, feel free to put it in the chat or just unmute yourself. No one. Oh, yeah, it's going to save the day again.
No, I've got, not necessarily answering your questions. I've got another question for you, if that's okay, related to your sort of your experience. So you mentioned gaining access to an accurate sort of sample to reflect the population is is an issue, and I think that's actually an issue with a lot of research, not necessarily sort of international research. So you now have sort of like an opportunity to compare sort of in pre-COVID time, the sample you were able to access, and then in COVID times. And are there any sort of differences there? Because I can imagine that the people you could get access to using online technologies might be different. And is there something there to look at, perhaps? Have you thought about that?
I've definitely thought about it in terms of that we're going to have a different type of sample in terms of those people who have a mobile phone versus those who don't. So we're potentially missing those people who are in technology poverty. But at the moment, we haven't finished getting the sample for all the remote research. It's because it's opportunistic, it's also snowballing as well. So at the moment, I haven't been able to undertake the comparisons, but I think that would be really interesting to look at.
Yeah, and I think, I mean, what I really liked about both presentations is sort of not just looking at the challenges, but also the opportunities. And this might be one thing to kind of actually giving an opportunity of sort of like what are the differences and between those samples, and what kind of, are there any differences between them with regard to any of the outcome measures you look at as well. But yeah, very, very interesting research and lots of challenges again. That you managed to overcome. So well done on that.
Thank you so much. Does anyone else have any other questions or discussion points for Catherine?
If I can just pull together a little bit, sorry, I think your first question, Catherine, about how do we maintain collaboration in this time of obviously remote access kind of made me think about Maggie's question a little bit more as well, in regards to obviously how do we keep up this momentum when we can't travel and we're losing funding. And I really thought about how actually something that me and Sarah, because we belong to the same lab, are struggling with is that in this time of remote access, we are utilising our existing infrastructure really well, and we have some fantastic collaborators who we are able to keep working with and keep training. But actually, we're finding it more and more difficult with this remote access, and especially the lack of funding, to gain any new opportunities and any new collaborators. That's where it's actually really falling at the moment in regards to international research, from what I've noticed, and I'm not sure, Sarah, whether you'd agree with me, is that those new partnerships that we were starting to foster just as COVID hit, they're really lacking now, because we can't offer them any funding to help with obviously what they're after, as well as when you're relying on them so much to help you do the research on the ground because you can't go. I think that's something that's really, really difficult. So we're managing to keep working with our current collaborators, which is fantastic, and we're so grateful for them. But how do you keep moving and create new partnerships and new projects?
Yeah, thank you, Laura. That's a really good point, and I'll touch on it a bit in my presentation, which is up next. If no one else has anything, I'll move on. Oh, okay. Mark asked, has your or anyone's research switched direction entirely? My PhD started to research an initiative, but this was shelved after 1 year, led to a new direction completely. Do any of the previous presenters want to address this? If not, I can give a preview about what I'm going to be talking about. The short answer is yes, basically.
I would say that I haven't changed direction completely, but it's morphed into a slightly different emphasis and different area, and looking at the potential differences it's mainly just a different area and emphasis, and different data sources as well. So it wasn't what I initially wanted to end up doing and have the effect, but it's created, it's morphed into a different area effectively.
Yeah, I think for me, similar. I actually think the main interest for me was to go to Pakistan and do that research, because so little has been done, particularly qualitative research of interviewing people. So I think, yeah, I'm really sad that bit had to go, and the shift is now more on diaspora populations, so Pakistani populations within the UK. So I guess probably similar to Catherine, yeah, it's still within the sort of theme of suicide and self-harm within Pakistani populations, but it's not anymore in Pakistan, and that's been the kind of big shift. And that was the sort of whole foundation of the PhD, in a way, of like we see the kind of high rates within Pakistan and not a lot being done in terms of qualitative research.
Thank you. And then Eric's question is relevant to what both of you just said. He was asking about the language barrier in the countries that you're conducting research in, and how you overcame this, and how research assistants were helpful in that process.
So I was using students from the University of Rwanda to help me with the language barrier and translation. And so I was equipping them with skills, research skills, in return for them being my sort of translators for me. And it's something that is very difficult, and you're trying to, especially when you've got niche languages like Kinyarwanda, where you try and explain something and then translators come back and say, but there's not a word for that in language, and how do you try and explain? And so you've got to really think creatively at how to try and explain it. And especially when I was doing a lot of the training for the students, I did a lot of visual representation so that it was clear what I was talking about, and then they had the discussion between them when they were looking at translating some of the surveys into what actually the meaning was, so that it was correctly translated. But yeah, I don't know whether Maggie has anything to add to that.
Yeah, I think it's so tricky. I have so much respect for translators. I think it's such an incredible skill, because you can kind of speaking a language, but then actually being able to translate the language is just a whole other level. And I had similar issues with things like self-harm conceptually. People described it as a certain act, so they described it as cutting yourself. But I was also interested in various behaviors, not just cutting as a form of self-harm, but when that's the term used, it starts to kind of limit the conversations. It was, as in Pakistan, it was easier when we did kind of initial focus groups, that it was all in Urdu, and I just kind of signed in and tried to follow as much as I could, and then it was kind of recorded and translated back. I think in Birmingham, there's some people that I spoke to who didn't speak English, and there's other people kind of translating for me there, but we never actually had a formal interview, and I think that would have been really insightful. But it's really difficult, and actually having somebody who can also have those sensitive conversations and then sort of following the same topic guide is, yeah, it's difficult. You'd want to do it so much better and so much more accessible, but I think language is a huge one.
Yeah, I actually have previous experience in research I've done during a previous degree in Tanzania, and relating to what Catherine said, the language was one thing, but also I had to train my research assistants to kind of follow the protocol so that my research took the direction I was hoping it would take. And so I had to think about translating things from English to Swahili, but also making sure that the conversations kind of flowed naturally and the questions were sequential in a way that made sense to what I was looking at. But it was really hard for me when I picked up maybe every fifth or sixth word in Swahili to know how the research was going in the moment until I could get the translations later. So it's definitely a big concern. And I think research assistants are really vital in the process and have been really helpful. If no one has any other questions, I'll move on to me. It's kind of weird to introduce myself, but I will. Let me just, okay. So my name is Sarah, and I'm a second year PhD student in the Applied Memory Lab with Laura. And I have an introduction slide, so we can talk a bit more about me in a second, but I'm a second year PhD student in psychology. And I just wanted to give thanks to Rights for Time, who's been really instrumental in helping my research and helping this project, and has just played a big part in my PhD so far. So the title of my talk is Zoom is my new best friend, because that has been the case over the past year. So just what we're going to talk, or what I'm going to talk about today, I'm going to go over some background about me and my research, and then I'm going to talk about the original plan of my PhD, and then how it's been adapted and how it's been going so far, bearing in mind that I'm still in the middle of it. I'm still doing my interviews and trying to recruit people. So as I said before, I'm a second-year PhD student. My background is in public health and health policy, both with an international lens, which is part of what really drew me to this PhD. And my PhD is analyzing medical and legal barriers to post-rape service provision in Kenya. So these barriers include financial barriers, such as the money needed to get to the hospital or to print police documents, structural barriers, such as the lack of available healthcare in certain areas, and societal and cultural barriers, such as patriarchy and societal norms around sexual violence. And my project would not be possible without the Wangu Kanja Foundation. And the Wangu Kanja Foundation is an organization in Nairobi that was founded by a rape survivor about 15 years ago and works to connect rape survivors to services in Kenya. And my supervisor, Heather, had an existing relationship with this organization, and it has been truly a lifesaver, especially during COVID. So how I was originally planning on running my PhD research is I was planning on doing fieldwork in Nairobi, Kitui, and Kiambu, because with my background, and I also have a sociology background, it was really important to me to compare the differences in access between urban and rural areas, but also different tribal groups and different cultural groups. So my original plan was to do fieldwork in these 3 cities, and I was hoping to go out for multiple month-long visits over the course of my PhD. I was also planning on conducting in-depth interviews myself, especially in Nairobi, where almost everyone speaks English. I probably would have needed translators or research assistants in Kitui and Kiambu, but in Nairobi, my original plan was to conduct the interviews myself. And I was also planning on holding focus group discussions with survivors in each city, and that would have been facilitated with the help of the Survivors of Sexual Violence Network. So this was my grand plan that I had been looking forward to, and then we all know what comes next. COVID came next, and everything changed basically. I couldn't travel internationally, and I already actually had a few trips booked to Kenya that I had to postpone and then finally cancel. I couldn't do immersive fieldwork, and on top of conducting the interviews myself, I was also really looking forward to taking like a baby ethnographic approach. I obviously wouldn't be able to be there for a long period of time, but I was hoping to shadow the professionals and go with the Survivors Network into various areas to see what kind of work they were doing. But obviously that has not been able to happen. And also no more face-to-face interviews, which I think face-to-face is better for a lot of reasons, rapport. I think the conversation flows better. There aren't technological issues. So a lot of things changed immediately once COVID happened. So when I was figuring out how to adapt my research, there were a few main concerns. The top concern of mine was the safety of my participants, not as much the medical and legal professionals, but the sexual violence survivors. I didn't think it was safe or ethical for me to research them, to interview them online if I couldn't guarantee like who was sitting right out of sight. So I didn't want to interview a survivor if their abuser was just sitting right next to them. So that was my main concern. And then also my sample size, because I was relying pretty heavily on being on the ground and being able to find people to talk to, and then finishing in a timely manner. Everything takes longer when you're far away. So I think those were my main concerns. And then this will just kind of explain what was supposed to happen versus what has been happening. So as I mentioned previously, I was really looking forward to shadowing professionals, but now I'm doing structured interviews on Zoom, and they've been okay, but my experience has been limited and my recruitment possibilities have been limited. I haven't been able to go to a facility and say, can I speak to you? Let's schedule a time. It takes a lot more organization and is not going too well at the moment, but I'm working on it. And then again, my original plan for fieldwork was to be with the survivors myself, but now, as I mentioned, I didn't think it was safe or ethical for me to conduct the interviews. So now I'm having proxy interviews done. I'm having gender defenders and other members of the Survivors of Sexual Violence Network conduct the interviews for me. And so far, they've done 2 focus groups that have been audio recorded and sent to me for analysis. And those have been in English, which is great. I won't lose anything in translation, and they both were attended pretty well. So that's been a success. And then again, I was supposed to travel, and I've instead been in my living room for a year, which is not ideal for multiple reasons. But yeah, so it's been a big change. A few issues have come up. Finding participants, I think, has been my biggest issue, because before I was relying on myself to find people and being there, but now I'm relying on different organizations to send me lists of people I can contact. And then of the people I email, probably 80% never email me back. And then of the ones who do email me back, we can't find a time or something happens. So it's been really hard for me to find the numbers that I was hoping for, both of survivors and the medical and legal professionals. And finding participants outside of Nairobi has proved to be virtually impossible up to this point, because I have connections in Nairobi that I don't have in Kitui and Kiambu. So it's been really difficult to find more rural participants, which is something that was really important to me. Technology has been an issue. You know, people have different Wi-Fi connections, there are different time zones, sometimes the video doesn't work, so technology has been an issue, but we've mostly gotten around it. Timing has been another thing. There's a time difference between here and Kenya, so sometimes it's hard to find a time that works for both parties. And the general logistics have been difficult, just getting research permits, and I have to pay in USD, and some money got lost in transfer fees, and then I had to keep sending smaller and smaller increments to reach a certain amount. So things like that that you don't really think about kind of build up and really impact how the research is being done. And then also, I'm on lockdown and people in Kenya are in lockdown. So the people I am speaking to are at home. And so I have one interview that I've tried to code a few times, but there are kids screaming and banging things in the background, and I just can't get through it. So these are other things to consider. Not only am I at home, but other people are at home, and it affects the type of interviews that I'm getting. And reliance on others has probably been my second biggest issue. I think I'm a bit of a control freak, and it's been really hard for me to depend on everyone else to find participants for me and to set up times and to set up focus groups. I know that I can count on myself to get things done, but I am not so confident in other people. So maybe I should work on that. But it has been a difficult part of this work for me. How it's been going, as I've said, my recruitment is lacking. I was hoping to have about 80 participants, and after months and months of looking, I have 7. So the recruitment is going pretty slowly. The snowballing isn't happening. After every interview, I email the participant, I say, thank you so much, please feel free to pass my email along. And it just doesn't seem to be happening. And of course, I still have tech troubles. But my research is still happening, albeit slower than I was originally hoping. And as previously mentioned, resources have been saved. It is free for me to sit in my living room, and my carbon emissions are much lower. So that's been a plus. I have a few takeaways that I've learned so far. My first is that it's okay to be upset about what could have been, because I, like Maggie, a big appeal of this PhD was the international travel. And I was actually supposed to do work in India as well, but we've had to totally scrap that because we don't have connections in India like we have in Kenya. So I think it's been important for me not to beat myself too much about the fact that this isn't what I was hoping it would be, and it's okay. And also I've acknowledged that moving forward is the key to success. So I can be sad that I'm not in Kenya, but I also need to keep doing my research, and that's what I've been doing or trying to do. And another big takeaway has been to consider the safety of the participants. As I mentioned previously, I just didn't think it was ethical the way to carry out survivor interviews the way I was carrying out professional interviews. So this is something that's really important to consider when you're conducting research online. And then another takeaway, which again relates to what Maggie was talking about, is no matter how much you plan, things will go wrong, and that's okay. I worked so hard to set up these interviews, and then kids are screaming in the background, and I can't be angry about it because childcare is important. We're all on lockdown. So you just kind of have to let things go. But so far, I'm grateful that I've been able to carry out my research at all, and I haven't totally had to scrap the PhD that I was intending. I have a couple of discussion points as well. My first, or questions. My first is what other methods for recruitment would be beneficial in a situation like this? If anyone has tips, I will gladly take them, because as I've mentioned 10 times, I'm really struggling in this area. And also, how might you have restructured your research in a similar situation? Thank you. Does anyone have any questions for me? Or answers for me?
Sarah, can I go?
Yeah, thank you.
Yeah, well, my research examines how the lawmaking process on climate change enhances or not the incorporation of local knowledge and practices in that process, using Kenya as a case study. And I've just had similar challenges like you. I'm in my third year and still not very clear. I've clearly moved from in-person to remote interviews, the same kind of plan which you had at the beginning. And one of the things is about, you know, the recruitment of participants, which is a major issue for me. I don't know how you've succeeded to manage to get the ones you've already gotten, whether trying to solve the structural problem in terms of helping to support the cost of the internet from their end would be a useful thing to do. Whether that would, I mean, it's not trying to influence, you know, whatever, you know, information they give on your interview, but trying to just facilitate the process for them to be able to get access to that tool so you can better engage with them. Is that something you thought about? Is that something you used, and how did this shape the process, if any of you did use that in your research?
Yeah, I have thought about it. With the Wangu Contra Foundation, we've sent airtime to them previously for previous work we've done. So we definitely have that capability, but actually so far no one has expressed that as an issue to me. I think maybe because my research so far has been in Nairobi and people have been calling me from home or from their offices, it hasn't been a problem so far, but it's definitely something I'm aware of could be a barrier. Just no one has really asked me about it yet. But yeah, I mean, at this point, I'll do anything to get someone to talk to me. So, but yeah, no one's brought it up so far. Does anybody else have any questions or comments? Any recruitment tips? I can say that, so I've actually, because I'm in the process of renewing my research permit in Kenya, and I've amended my ethics to change how my recruitment will work, because previously we had that I couldn't reach out to people, only the organizations we were working with could recommend people to me, and it just wasn't happening quickly enough. So now I've amended it to say that I can cold call people. And so I've been finding people at hospitals and LinkedIn in Nairobi and Kitui and messaging them and hoping that they'll message me back. So I'm hoping that with my new research permit and my new approach, things will go a bit better. Great, thank you. Oh, sorry, did you have something else, Eric?
Yeah, I mean, you just reminded me, I'd not thought about, you know, renewing the permit and thinking about the amendments I'm making. And so that helps me to think about this while I do the new amendments, because I was hoping to also go through organizations, but I only want to be talking to persons,
Yeah,
myself, and getting and recruiting the participants and talking to them. So it's been very helpful. Thank you very much.
oh, great. Yeah, and also, yeah, I'm also in the midst of affiliation letter issues, because you need an affiliation letter from an institution. So make sure you're clear on that, because the one we had last year apparently isn't legitimate and the new one is quite expensive. So just make sure you've thought of everything. But thank you so much for the questions. Up next is Laura. Laura is a first-year PhD student in the Applied Memory Lab with me. We are Team Lara in the lab. And she's looking at theoretical memory principles and interviewing techniques for survivors of sexual violence. So here you go, Laura.
Thank you. So my talk today is going to be on my project, which was investigative interviewing training in Kenya, while I can't go myself, during COVID-19. So just a little bit of structure to what my talk is going to cover. I'll give a little bit of background on myself and also the study that I'm talking about, just to contextualize it. And very similar to Sarah, I'm going to take the approach of telling you what this research would have looked like before COVID-19 versus what it has ended up looking like during COVID-19. Then give you some of my overall take homes of what I have learned over the last 12 months and offer again some time for questions and discussion at the end. So just a little bit about myself, as Sarah has kindly introduced me. I am a first year PhD student, so what a year to join in on. But I suppose at least I knew what I was signing up for, whereas the rest of the students on the panel, obviously they were thrust into this situation. So don't know which one's kind of better or worse. But I am an eyewitness memory researcher, so I'm a little bit of a hybrid. I do both domestic and global challenges research. So I'm looking at eyewitness memory. So how can we incorporate best practice interviewing principles and what we know theoretically about memory into innovative interviewing practices, in particular with survivors of sexual violence. So as well as being a PhD student, I also work as a research assistant in the Applied Memory Lab. And this has given me some fantastic opportunities to also collaborate with the Wangu Kanja Foundation, who Sarah has just introduced to you. So I could have put up a load of words about the current study that I've been doing, but I thought instead I'd show you the fantastic network that I'm working with. So on the screen, front and center is actually Wangu Kanja herself, who is the founder of the Wangu Kanja Foundation, our fantastic collaborator. And behind her, you can see members of the Survivors of Sexual Violence Network in Kenya. And we did gain permission before using any of these photographs. So the Wangu Kanja Foundation convenes the Survivors of Sexual Violence Network in Kenya, and this group of survivors are often first responders for new cases of sexual violence. They are known members of the community, and when an incident occurs, the survivor can feel comfortable to approach this network to gain access to different post-rape care services, as well as to document the incident that has occurred to them. So when we were discussing with this survivors network, we realized that they did not have any training in how to approach this topic sensitively and in a way that was going to document that memory evidence that would be protected from forgetting in the future, because it takes quite a long time to get from incident to court case. So you want to consolidate and protect that memory across that period of time. And you also want to make sure that it isn't being contaminated in any way when it's being collected, because often what can happen when they go to court is they will be questioned very heavily about who they've spoken to about this incident. So it's really important that they are collecting this in a way that is not contaminated. So this study then was us actually creating a training program to train these individuals in how to document memory evidence in a sensitive and efficient way. So on the screen, you can just see one group of survivors that we have trained, but actually over the course of the year, I can proudly say that we have trained over 60 survivors who are first responders. And we've also trained 50 stakeholders and duty bearers along the criminal justice pathway. And we are now opening it up even wider, and we are having conversations with the police in Kenya. So overall, hopefully having some great impact. So how would this research have been conducted before COVID-19? So I would have started by doing a literature review of what do we know about interviewing best practice, what works, as well as what previous training programs have been conducted. And whilst nothing has been conducted in Kenya to my knowledge, or even in any other country in Africa, we have seen other training programs with police in like Australia, the UK, the US. So I was able to use some of those techniques to see whether or not they could be applied here. We then designed training materials from that literature, and these training materials covered what do we want our participants to learn come the end of the training, as well as practical activities, because interviewing is a practical skill. So we wanted to create materials that enabled them to actually practice that skill for future use. And then probably the most important aspect was that in-country consultation, because as I said, all of this research before has been conducted in other countries. So it was really, really important to me to show those training materials to Wangu Kanja and the Wangu Kanja Foundation, and to get their opinion on whether they felt that these training materials were culturally sensitive and context specific. And if they had any problems with anything, then they would be adapted before the training began. Before COVID-19, I then would have organised my travel to have gone along with Sarah to Kenya and done in-country delivery myself. But obviously with COVID, that hasn't managed to happen. So how was the research conducted actually during COVID-19 then? Because as I've just said, we have still managed to keep going. So I like to try and remain positive that the first row of all of that is exactly the same. My literature review, my training materials, and my in-country consultation stayed exactly the same. All of those things I would have done before flying out to make sure everything was perfect beforehand. So the first half of my research, thankfully, didn't have to change. But what was the largest difference was instead of me actually going over to deliver this training myself, I used a train the trainer approach, which is where I selected members of the Wangu Kanja Foundation and Wangu Kanja herself to actually deliver this training for me. And I trained her in how she would effectively deliver this training in my absence. She then delivered this training with her collaborators. They collected the impact and evaluation data for me and shared it with me. So what does a train the trainer approach actually mean? So it takes a lot of communication. So there was a lot of Zoom calls between myself and Wangu and the fellow collaborators who also helped us, where we were communicating back and forth between this is what I would have done if it was me delivering the training, you're going to be delivering it for me, what does that look like, what would you do, is there anything you're not comfortable with? And it was a lot of very, very detailed communication, as well as the detailed training materials that I created for the participants themselves. I also created exceptionally detailed training packs for Wangu and the fellow trainers to use themselves. So this included additional material to make them more knowledgeable about the subject area than the participants they were teaching. It also contained a script that they could have used if at any point they felt uncomfortable and they wanted to just read from a script, as well as a timetable for the activities of the day. So this in detail training material has actually been a great success, because if we wanted to roll this interview package out further than Kenya or elsewhere in Kenya, I now have a sustainable training package for trainers, which means that this can continue to move forward and forward and forward, because I wouldn't be able to go to each place to deliver the training. So that has actually been a fantastic success of this change. I also created a pack of key questions. We often get very similar questions when we're addressing sexual violence. So I wanted to make sure that the trainers had some pre-prepared answers that they could use if they didn't know the answer, as well as offering my email address. So if there was any questions that they didn't have the answer to, they could email me and I could get swiftly back to the participants. We then did a practice of the entire day where the trainers would use me as a mock participant and they would practice delivering the training so as I could make sure that they were confident and comfortable in delivering the training. They then delivered them training, which I was thankfully able to sit in on a Zoom call, and I could be present if there were any issues. And I asked them for their feedback. So what did they think went well in the training versus what would they have changed? So we were able to keep adapting and improving the training going forward. So overall, what's the key ideas that I have learned over the last year? Trying to stay positive, think about what actually can still be the same. My entire research project hasn't gone out the window and become something completely different. It has stayed very similar. There are just elements that have had to change, thankfully. Probably the most important part, as I said, is that partner consultation. As I said, I'm very, very lucky that I have a collaborator that we've had connections with since 2018. So we've got a very strong infrastructure that regardless of me being able to travel to the country, I can communicate with Wangu whenever I want to. But I did have to allocate a lot more time to this project than what I was anticipating, because previously when I thought it would be myself traveling to the country to deliver the training, I wouldn't have created such a training heavy pack for Wangu herself. So I did have to dedicate some time to that and to making sure that all of the trainers felt comfortable to deliver the project without me being there. I also had to think very, very carefully about my impact evaluation. As has already been noted in this talk, if you're physically present in the room, you can pick up on whether or not people are understanding what you're talking about. Whereas if I couldn't physically be there, how was I going to measure that people were understanding the training? So I had to think very, very creatively about how could I measure both knowledge, because interviewing is a knowledgeable skill, as well as the practical side of it. How was I going to measure that they could interview in practice? So this is something that would have to be flexible from study to study, but I would definitely recommend dedicating more time to your impact evaluation if you can't be physically present, as well as more than ever being open to feedback and adaptation, which I know has already been touched upon. So again, I'm happy to take questions, but if there are no questions, my point for discussion was all of my project has now fell very, very heavily to the Wangu Kanja Foundation. So how can we best minimise the burden on our in-country collaborators now that we can't physically be present? Thank you.
Thank you so much, Laura. That was great. Does anybody have any questions or comments for Laura? No. Again.
Yeah, I've got a question if that's okay.
Yeah.
What was really interesting to hear was that you are attending the training sessions sort of via Zoom, and you mentioned sort of in your at the end as well how important it is to be able to kind of read the room, if you like, and see how people are doing it, how people are, I guess, sort of understanding what is being said. How did you find that? Because that must have been, it's quite difficult if you're, because presumably you were the only one on Zoom and everybody else was in a room, or was everybody on Zoom?
Everybody else was in a room. Yeah, I was the only one who was there on Zoom at 4:30 in the morning our side, I must admit, as well, because of the time difference. So that was fun, sipping on my coffee whilst watching them engage in my training. It definitely was an experience, because I didn't want to undermine the trainers in any way. So even if there was something that they were doing that I might not have done had I been physically doing the training, I didn't want to undermine them by stopping them or talking over them, as well, because actually their adaptation might have been because that's better for the context. So it was the case of, I don't want to undermine them because they're on a roll and they're my trainers, so they need to look efficient, but they might have actually adapted it for the best reason. So it was difficult to keep my mouth shut, but just kept myself on mute all day. But I also then had a regroup at the end with the two trainers who did most of my training, and we spoke about why they changed it, and sometimes it was because they felt that that worked better and that flowed with the participants at hand and things like that. So it all came down to that communication. I feel like I probably learnt to communicate better with my collaborators and my partner in this lockdown, because we just talk all the time. But yes, it was also exceptionally difficult because of internet, and when you get too far away from a laptop, it is very difficult to pick up on what the participants are saying. So it wasn't ideal by any means, but I was still grateful to get to be part of the experience in some way.
Yeah, I mean, it's dealing with the opportunities you've got.
Yeah, very much so.
Yeah.
Thank you.
That's interesting. I have another question, just actually for that kind of is related to your question, Laura, that you put for discussion, and I think it's something all of you raised, is with regards to recruitment and the reliance on your in-country collaborators. What has been your experience with that? So did you, because you are all heavily relying on that, and even more so in those times, have you had any kind of, I guess, sort of more negative feedback from them? Or is that also, because in a way it could also be a positive thing that they, because they know that they have to drive it, that they might also take more, I don't know, control or more ownership over that? I don't know whether that's a too optimistic view of it, or any sort of feedback from your in-country collaborators on recruitment. And I guess that's for all of you, really.
I haven't had feedback specifically. I think they've been pretty helpful as far as sending me, like, putting together lists of people to email, and trying to help me with recruitment. And then when I was training or discussing with the people who were going to run my focus group discussions, I had a meeting with them to discuss it. And similar to what Laura was saying, I wanted to get my point across without being like, do it this way or else. But also, you know, I'm researching something specific and I'm going to want to analyze it. So if it's just not there for me to analyze, then I've got nothing. So I think I was trying to find a balance between being like instructive and not demeaning. And then when I was in that meeting with them, they just kept on talking to each other and ignoring me. So I really have no idea actually what the vibe was. But my focus groups got done, and I'm really grateful for that, because without them doing it, I don't think I could do a focus group discussion over Zoom. It's, you know, unless someone was like rotating the computer to point me to different people, I just don't think it would have worked. So, and I think the existing relationship we had with the Wangu Kanja Foundation was really helpful. I think it would have been much harder to come into someone new and say, can you do this and also these 12 other things. So I think because we have a history of like collaboration, it was really helpful.
Yeah, I'm sure that makes a very big difference.
Yeah, definitely. And something that's kind of been really important for us, especially with the Wangu Kanja Foundation, is I know everybody talks about capacity building, but that eventually we wanted to be able to give them the skills to do their own research. It's something that when we started the collaboration, they were really interested in. They would always say to us that people won't take us seriously unless the data and the publications are coming from us as the country collaborator. So actually, more than ever, you are right that COVID-19 has really helped with that they are the driving force of this, 1000%. They are the reason why I actually have data today. So it's been actually really, really positive to train them and to give them the skills that they are driving the research. And Wangu phoned me on Monday to tell me that she's organised another training programme and another 20 participants, and like she's just snowballed it and really taken charge with it. So it's actually fantastic to see taking some positives from it.
Yeah, that's great.
Great. If no one has anything else, I think we'll wrap up. We've gone 4 minutes over, so thank you for those who have stayed. I know it's Friday lunchtime, so thank you so much for coming and participating and asking questions. If you have any questions for any of us, feel free to reach out, and this recording will be uploaded on YouTube, and the link will be sent out and tweeted by Rights for Time and the Applied Memory Lab, so it'll be pretty easy to rewatch if anyone has any other questions. But if not, thank you so much for coming and have a good weekend.